One tool that I really, really enjoy using in my medical practice, which it really isn't even thought of as being a medical tool very often, is called the MBTI, which is the Myers-Briggs Type Inventory. You probably hear of it as the Myers-Briggs, and there's 4 letters that you have. And through that, I don't have to have the patient take a formal test. I was certified in giving that test 15 years ago, and then over time, you just kind of get to know what people's mindedness is. It's kind of like you're right-handed or you're left-handed. When I was a high school basketball player, we'd watch our films to see the next team we were playing, and I'd want to know who's right-handed, who's left-handed. Could they dribble very well the other side? And then you would try to play that opponent in knowing what their strengths and weaknesses are. Well, it's the same way with Myers-Briggs. You have your strengths and you have your deficiencies when it comes to the way you think and the way you deal with the world around you. And so for me, if I have a patient and I know they're really an introverted person, meaning that a lot of noise, a lot of energy probably isn't the best thing. I am an extrovert, so I'll find myself talking maybe a little bit softer. I'll sit a little bit further away from them in the room because they would tend to want their space and feel more comfortable that way. I pause and give time for them to process because introverts are thinkers first and then talkers next, whereas extroverts tend to talk and then think about what they said and then talk again. And so I find that's very helpful. Now, not everybody's really strong extroverted or really strong introverted. They're maybe on the fence. If they're on the fence, it doesn't matter how I approach them because they can adapt. But if I sense that they're strong E or a strong I, I'll try to adapt to that. Also, if a person in the Myers-Briggs, they tend to be what we call thinkers or feelers. And so a thinker is a person that really, like if they came in with a high cholesterol level, for example, and I want them to change. I want them to be from here to getting a low cholesterol through diet, through taking a pill. They really need a pill and they're not wanting to take it. If they're a thinker, all I need to do is show them their data because that's the way they take in material. They use their senses and they think, okay, I want to know what's right, what's wrong, what's high, what's elevated, what's normal, how elevated is it, very elevated, what's my risk for a stroke and heart attack. And I show them the numbers, and the more numbers I give the high thinker, the better it is. The feeler, on the other hand, their cholesterol number doesn't even matter because they're not going to look at it. But what I'll do is I'll say to the 60-year-old woman, say, do you have a picture of your grandkids in your purse? And pulls them out. Oh yeah, here's Jimmy, and here's Bobby, and here's Carol, and here's Sue. And I'll say, those are great. Now, how old are they? 8, 9, 10. Now, do you want to see them graduate from high school? That's what, 8, 10 years from now? Oh yeah. I mean, that's going to be great. I want to see them get married. I say, well, I'd love to have you stay healthy and not have a stroke or heart attack. But you really need to do one thing if you want to see your kids graduate, and that is to take your cholesterol medicine. You do that, the chance of you seeing them graduate is much better than if you don't. Do you think you can do that? And leave it at that. So you get the high feeler who you play with the emotions. You get the high thinker who needs numbers and data and going to play out the odds and determine that. It's very helpful. So the Myers-Briggs actually is a very good tool also in helping to communicate with patients and into motivating them to change. So good luck.